Thank you so much. I'm glad to be here today, and I'm happy that I'm presenting this afternoon. My name is Proscovia Nabatte. I work with Africa NCDs Network. Thank you so much. So my presentation is about community of practice for infectious and non-infectious diseases, integration towards universal health coverage in Africa. First of all, next slide please. First of all, who we are. We are a coalition of legally recognized civil society, NCD national alliances and organizations whose major aim is to promote and accelerate the implementation of NCD's agenda on the African continent through national and regional advocacy efforts. The journey to our creation started with a discussion at East Africa NCD Alliance Conference in 2015, and in 2020 at the Global NCD Forum in Sharjah, the Africa NCDs Network was officially inaugurated with over 14 national NCDs alliances. So the 14 national NCDs, they are located in Africa. We have representation in South Africa, West Africa, East Africa, and Central Africa. But we welcome more alliances and those organizations and civil society organizations that feel that when we work together, we fulfill our agenda of advocating for prevention, management, and control of NCDs in Africa. NN is a regional advocacy network working through a support system of sub-regions, national alliances, and civil society organizations and coalitions, hence the need for tested frameworks and models that can support the chain of engagement. Why we opted for the community of practice, as we shall see further. So, the network is undergoing why we adopted the community of practice model in our advocacy. The network is undergoing several transformation and developments, including stakeholders and members and partner mapping, as well as critical engagements. Therefore, it sought a solution that can actively and regularly engage its members and partners on relevant advocacy for a common cause for prevention and control of NCDs. As I have told you earlier that we work through different alliances and civil society organizations, and our advocacy work sometimes becomes, we have challenges in engaging such people. So we looked at this model as a platform that can help us engage regularly, also directly work with them so that we can push our agenda on this. So what is the community of practice? This is a learning strategy developed in the 1990s by Etania Wenger, a renowned social learning theorist and researcher. The model brings together groups of people with common interests to engage in joint activities and collect, learn, and develop their expertise in a specific domain or a field of practice. So the model was adopted by the NN to foster the goals of learning, effective collaboration, and serve to increase expertise and action around advocacy target domains on NCDs and other related health issues across the thematic areas that NN work with. So we have different strategic directions that NN work with in its own advocacy work. One of it, when we have capacity development on NCDs, we have engagement of people, especially what we call people power. We have also what we call resource mobilization, where we enforce mobilization of resources for NCDs prevention and management. And we also have increased the research, where here we encourage and also advocate for more research around NCD topics, issues, and also other related health areas. So, community of practice allows the NN to dive into specific needs, challenges, priorities, and collaborative efforts of advocacy efforts. The model is informed by a strong collaborative setup, and members' expertise, experience, knowledge, and practice, hence making any invaluable addition to advocacy agenda for Africa. The African NCD network has therefore used the model to actively engage its members involved in or interested in integrated care, a recommended strategy to improve access to people-centered care for people living with NCDs, as well as a strategy to expedite the attainment of universal health coverage. So this is where we adopted the model to ensure that we work with different expertise from different regions in Africa on integrated health care as a way of achieving universal health coverage. Since 2023, we have taken a community of practice in form of engagement sessions on infectious and non-infectious diseases integration towards universal health coverage. These sessions convened 40 experts, include from Uganda, Cameroon, South Africa, Malawi, Nigeria, Burundi, Tanzania, Ghana, Kenya, and others on integrated health care, especially in Africa. The shared interactive sessions provided a platform for experts to share their country's experiences and efforts on embracing integrated care as a key factor to universal health coverage, track gaps and challenges that limit integration in some countries and healthcare sectors, and provide recommendations. So we went on and mapped some of the key or critical experts in integrated health care in different areas of health, especially those also work with non-infectious and non-infectious diseases in Africa. So after the mapping, we came up with 40 experts, and these we brought them together to share ideas on the areas they have been doing this work on, and how they can build. They tracked the gaps, they tracked the challenges. These experiences were based on the work they are doing in their communities, in their countries, and they made recommendations on how far we can go when it comes to integrated health care in Africa. So some of the key topics on integration of infectious and non-infectious diseases that were discussed, those that actually were so critical in those community of practice sessions. One was integration of infectious diseases and NCDs, the rural doctors approach. This was from, I think, Malawi. Yes, this was from Malawi. They were able to tell us the rural setting and how doctors are actually integrating healthcare when it comes to infectious and NCDs. How can we try to do that? Then the second one was about laboratory services and integrated care, integrating laboratory diagnostics into NCDs and infectious disease care. Then the third one was NCD integration. This was from Uganda. We had an expert from Uganda that talked about the laboratory services. Then NCD's integration, health systems, challenges and opportunities for universal health coverage within the Cameroon Baptist Convention Health Services. Yes, of course, that was from Cameroon. And sorry for that. And Malawi's move of integration on NCDs and HIV. So we had different types of integration. People shared them. They shared knowledges, they shared the gaps, tracked the challenges, and made collaborative recommendations. These are the experts we are still working with to ensure that we move this on and see how we can go. So some of the achievements so far when we engage these people, when we use the community of practice model, one is integration best practices shared by the practicing countries. The ones the topics that were shared, like Malawi, Cameroon, and Tanzania, and others, provided a benchmark for further work on integration. So when they were discussing, that's when they tracked some of the gaps. That's when they saw opportunities of some of the area of topics that really need to discuss about when it comes to integration. Then the community of practice activity allowed stakeholders involved in prevention and control efforts to build networks and share experiences and build networks that democratize access to working within South Africa. So yes, when there is a team that actually combined to work on some key areas in South Africa. The community of practice pointed out gaps for previous experiences and areas in which the existing actors can focus on the prevention and control of NCDs. For example, you might realize that there was a certain focus in Uganda, neglecting some of the areas of integration, yet Malawi was very strong on such areas. So these people, when they are engaging or interacting, they realized they tracked such gaps and they became opportunities of research and discussion on integration. The experience indicated more benefits of integration on NCDs to other health alignment with like patient rotation, reduced cost efficiency, and among others. Some of the recommendations were actually so many, but I had to track out some because of the time. Government should invest immensely and support universal health coverage, incorporate NCDs into public health agenda, maintain mental health projects, and create an enabling environment for NCDs management. As you realize that the NCD world, advocacy world these days, they are really very curious about mental health. They are advocating for proper health management when it comes to mental health. Then another thing is that incorporate NCDs in the public health agenda. In the discussion with the experts, it was realized that NCDs are looked at as a by the way when it comes to health, public health agenda. It is looked at as a by the way. So the people were saying it should be fronted and be part of it, and also when they allocate resource to health, they are also given a certain independent budget. Create a favorable regulatory environment to guide NCD work. Yes, so many policies really need to be reviewed and also more to be developed. I'm finishing. Establish robust monitoring and evaluation system to collect, store, and manipulate data for improved decision making. Combine resource mobilization with other successful pools like the HIV funding centers. So that's one of the key reasons why we really needed to have this model, because we shared why the HIV vis-a-vis other integration works and what has made others to fail. So it was a very interactive and practical session. So here we are, the last. So after the whole discussion with the experts, we agreed to have a review paper, and the review paper is being developed currently, and it will be about collective development of the review paper. Yes, integrated care of infectious and non-infectious diseases in sub-Saharan Africa, challenges and best practices. So the review will likely inform the broader healthcare needs for a fully integrated system of NCDs and other chronic conditions within sub-Saharan Africa. It will furthermore provide evidence and help policymakers to address the complex challenges of NCDs within the broader health systems. So thank you so much, Africa NCDs Network again. Special thanks to the World Diabetes Foundation that enabled us to have this model into implementation by funding us. We also worked hand in hand with NCD Alliance East Africa to ensure that we put this together. And special thanks to the conference organizers. Thanks for inviting us to share our work here. Thank you.
Wow, thank you so much. Any two questions as we prepare ourselves to enjoy what the organizers have prepared for us? Any two questions? All right. Maybe as I get to a question, I have a question myself. Given that it's a COP and you're trying to see, you're saying you have been doing more in online webinars or trainings, and how has been the follow-up? Do you train people? Do they come back? Is there a system? Is there a group? How do you follow up those people?
Thank you. I'm Triza. My question is almost the same like his. What you are talking about is very good, but do you meet people and tell them what can help them in the rural communities, in the villages, in the urban areas? Because in the urban areas like Kampala, we have a market like Owino, like Kalerwe. People are selling good things, but are they aware? Because I always meet people who are suffering with eyes. I advise them to eat carrots. One time I already told him that that carrot is for the rich people, not us. But I told her why she's supposed to take a carrot. And the eyes were cured. And she was so happy. Do you go around and meet such group? Thank you.
Thank you.
Thank you very much. My name is Charles, and I'm a student at Makerere University School of Public Health, doing public health itself. Thank you for your presentation, and I want to appreciate the fact that the work that you collected is not from one country. It is work from different countries. So I will think that there is a collaborative effort that you have put together to see that the work is put together. So my question is, to what extent is the government your partner in trying to fight against NCDs and also the infectious diseases? Because among the partners that you have spoken about are the organizations. So to what extent are the government of these countries involved in supporting your programs? Thank you.
All right, thank you so much. I'll start with the first question. You said, do we follow up with the people that we work with on this community of practice? As I earlier mentioned, is that we mapped and selected 40 experts from different countries in Africa, and those are the people we've been working with. Actually, we don't train them, but we are working with them. Yes, we have these experts, regular experts on integrated care from different countries in Africa. Their aim is to sit, discuss, evaluate, have more engagements, and see how far we can go when it comes to integrated care. So they share experiences from different countries and what they have been working on in communities. So when they sit as them, then they track the gaps. Yes, they track the gaps, they track the challenges, they make recommendations. So it's not way of training, but a process of sitting, share knowledge for further opportunities or for furthering something. So my lady, you talked about whether we engage in communities. We actively do engage communities. But as I said, that we are a regional organization that works through alliances. We have different alliances in different countries, and here we have a secretariat of the East African NCD network and Uganda NCDs network. So the Uganda NCD network will be here tomorrow to discuss what exactly we do in communities. They have really done very good work, when it comes to policy formulation and enforcements. Yes, last time they were talking about enforcing the tobacco control bill in the parliament. They have moved to different countries of this, to different areas of these countries. Moroto, Gulu, were trying to enforce NCD's prevention and control in different health centers. So we work through those chains. That's the reason we say that as the regional network, I think we need the community of practice, because we realize that we need to engage through, we engage through chains of work. So, and there are so many alliances that we have worked with. There is the Rwanda NCD Alliance, Kenya NCD Alliance, Burundi NCD Alliance, Cameroon NCD Alliance, Ghana NCD Alliance. So those basically in countries, they do practical work on ground. They engage people, they engage communities. So, but the regional one, we do the chain, we go through that chain. So, the gentleman, let me hope I have not forgotten your question. Can you please repeat? Yes, so one of our tasks is to ensure, to enforce government accountability, to actually to ensure that government engage in, become active when it comes to prevention and NCD control. So as a regional network, when I refer to the East African NCD Alliance, we have actively engaged with the government, especially the health department, where we also have the NCD department. When you go to the health ministry in Uganda, there is that NCD department. So we have gone through policies, we have engaged them in different areas. We have brought them on policy ground levels, and also ensure that they actively help us when it comes to advocacy. When we go to community, we don't go as we independently, but we always work through the Ministry of Health. So we always work with them, because without them we can't enforce. They have the power.